The next question that I'd like to approach is, how do you diagnose hepatic encephalopathy? Hepatic encephalopathy occurs in patients that have underlying cirrhosis. So you have to have cirrhosis to develop hepatic encephalopathy. Then we divide patients into two large groups of hepatic encephalopathy: covert or subclinical, which is very difficult to diagnose, and I'm going to come back to that, versus overt. Overt is not difficult to diagnose. There are some classic symptoms that can be seen: fatigue, disorientation, inappropriate behavior, severe memory loss, confusion, slurred speech, and even coma, are typical symptoms of people that have hepatic encephalopathy. When someone with cirrhosis comes in, however, and has those symptoms, it's important to make sure that there's nothing else going on. Meaning, every time a patient with liver disease comes in and is confused, doesn't mean that they have hepatic encephalopathy. So it's very important to ensure that the patient doesn't have any other type of neurologic or metabolic abnormalities. And you'd like to look for a potential cause, as we've discussed in the past, of hepatic encephalopathy. Was the patient constipated? Is the patient dehydrated? Is the patient infected? Has there been a GI bleed? Is there something that can precipitate this? In patients that are awake and able to answer, there are certain tests that we can do, simple tests. So we do something, for example, called a mini mental exam, where we ask some simple questions to patients and ask to see if they can answer them. Some may be as simple as knowing their name, the date, and where they are, who is the current president of the United States. But we can do things that are a little bit more difficult, asking patients, for example, to count backwards from 100 by 7, for example, 193, 86, 79, spelling the word world forward, and then spelling it backwards. These are things that can be used simply by talking to a patient to determine if they have encephalopathy. There are more advanced tests that can be done. For example, an EEG can be done. There are certain things that we typically see on an EEG in patients that have hepatic encephalopathy, but quite frankly, doing that is difficult to obtain. Patients show up in an emergency room in a hospital. These tests have to be ordered. It may take a few days. It's just not an easy thing to do. And then even there are some apps that can be used, and I would like to highlight just one. It's called the Stroop Test, which is an app that's easily downloadable to any type of smartphone. It's a test which measures the time to perform a test, and it's compared to a normal. And what it does is it asks you to recognize words and colors, and it assesses the time to a task when the name of a color is printed in another color. So, for example, the word blue may be printed in red. And what this test is asking you to do is tell you what the color is. And you have to think about that a little bit, because you're reading blue, you're thinking blue, but the answer is really red. And there are multiple of these questions, and then you get a score and you can compare it to normal. And it's a very simple way of assessing if someone has developed uh, hepatic encephalopathy. People talk about ammonia levels, but we really do not use ammonia levels to diagnose hepatic encephalopathy. Hepatic encephalopathy is a clinical diagnosis, which means you assess the patient, determine they have underlying liver disease, make sure nothing else is going on, uh, and then make that assessment. In many patients with hepatic encephalopathy, the ammonia is normal, and in many patients without hepatic encephalopathy, the ammonia levels are high. So it's not something that we get routinely to diagnose this, and it's certainly not something that we follow. I'm just going to come back briefly to then, how do we diagnose covert encephalopathy? This is much more difficult. These are patients that may have mild confusion. They may just have some agitation or irritability. They may just have some difficulty with sleep or some slightly decreased attention, but it doesn't necessarily overtly affect the way they interact with others. And here, the tests we talked about, such as the Stroop test and others, for example, something called the number connection test, where you have to connect numbers on a page in a certain period of time are very helpful. But I'm going to circle back to the way we diagnose hepatic encephalopathy is looking at all of these different factors and realizing that hepatic encephalopathy is a clinical diagnosis. There isn't just one test, but it's important to recognize that you can't diagnose hepatic encephalopathy unless somebody has underlying cirrhosis. So you need to know that.